So, hey guys, hello, good day to all. So today, at the last part, we ended at management of shoulder dystocia. Okay, so I'm going to continue from there. So let's start. So for the PDF, guys, I always recommend to use the new one. Okay, it's already in our group. The link in the description. Okay. So next, moving ahead. So next, we are having the here. So we are having the management of the shoulder dystocia. Okay, the first one is the first one is the first manual you are going to do is the Mac Roberts manual. What is that? Mac Roberts manual. How to first of all see here, flex the leg of mother against the abdomen, then abduct it. Okay, but what is the most common complication here? It is it's going to damage the what? Injury to the lateral coordination of thigh. Okay, remember how they are going to ask the questions. Either they are going to ask the questions like arrange the following maneuver we had which is done during the shoulder dystocia. Okay, or else they are going to ask you uh, okay, after Mac Roberts maneuver is if Mac Roberts maneuver is failed, then what is the next step? Is the suprapubic massage. It is the suprapubic pressure. Then what if suprapubic pressure, also called a Robin bone, is failed? The next is the Wood Woods-Carskew maneuver. Then what if Woods-Carskew maneuver is failed? Then you have to go for the what? Gaskin maneuver. What is the Gaskin maneuver? For the last step, you have to do the January maneuver. It meaning if the baby is not coming, then you have to push the baby inside the uterus and you have to do the C-section. Got it? So it's already this is the neat PG bit, neat PG bit, also the and this one is the FMG bit, MCQ. So everything is going. They are going to asking. They will ask from here only. Okay, the first one, what you are going to do? Mac Roberts manual. The next one is the suprapubic massage or pressure. Okay, then the next is the Woods-Carskew manual. Then you have to do the what? Gaskin manual. That is the this is the dog position here. Okay, you have to keep the baby like roll on four limbs. Okay, roll on. Sorry for the dog position. I told this is the roll on four limbs here. Okay, now if it is failed, the last one is the you have to the January maneuver. Okay, now that's it. I mean, remember Mac Roberts maneuver, suprapubic massage. Okay, Woods-Carskew maneuver. Then or Gaskin maneuver. Last is the January maneuver. That's it. Okay, so what is the common complication of the shoulder dystocia? It is it leads to brachial plexus injury, which is called as Erb's palsy, Okay, due to brachial palsy, what is C5 and C6 is involved, the brachial palsy. Okay, the next one you are going to discuss about the abortion here. Types of abortion here. See, what is abortion? It is the unexplained natural abortion. It's called as spontaneous abortion. So, okay, na? Spontaneous abortion. Remember, what is the most common cause of the abortion is the chromosomal abnormalities. It is the chromosomal abnormalities. Okay. So, what is the meaning? What is the definition of a recurrent abortion? Meaning defined as the sequence of three or more consecutive spontaneous abortion before 20 weeks. How much? Three or more consecutive spontaneous. Okay, now consecutive spontaneous abortion before 20 weeks. It is called as recurrent abortion. Let's see the types of abortion here. Okay, so we're having the first one is the threatened abortion. So actually, it's not life threatening, but it's a threatened. Okay, now so when it is threatened, guys, remember, guys. So here on ultrasound is going to there is a viable fetus. The fetus will be live. Okay, now only 5% having a chance for the abortion, or else this this type of abortion is absolutely safe. Okay, obviously in threatened abortion, if there is a live fetal, then obviously the service is going to close now. That's it. Simple. Hmm? The next one, inevitable. Inevitable means water. There is a watery discharge. This is a watery discharge, meaning there is a rupture of the membrane. There is a rupture of the membrane. Okay. So obviously there is a increasing bleeding and cramps with the rupture of the membrane. There is a watery discharge. There is a watery discharge. If you see any question, there is a watery discharges, then you have to go for the inevitable abortion. Here also, the service is going to be closure, and after that, it's going to, when it is going to expel out, then obviously going to open. If you see the ultrasound here, there is a death of the fetus. So there is a fetal death here. Okay, then you have to do the DNC, and also you can give the misoprostol for the expulsion of the content. Okay, the next one is the incomplete. Okay, there is a incomplete. What is incomplete? Meaning this is the uterus, meaning half of the content. Meaning half of the content is already expelled out, but half is remained. That is incomplete, na? See, extremely heavy bleeding and passage of the tissue. Obviously, if it is half of only remain, obviously the cervix is going to open only, na? Open only. Ultrasound, what you see, products of the conception. That's it. Okay. Next one, complete means there's nothing in the uterus. There is nothing in the uterus. Meaning all the contents are already expelled out. There is a bleeding. Complete must pass at the site. Obviously, if it is completely what expelled out, obviously the cervix will be opened down. Na? So if you do the ultrasound, there is a no products. Okay. Next one, the mixture. Mixed abortion means what? There is a no bleeding because there is a death of the fetus. Death in utero. Death in utero. We'll see the Spalding sign. We'll see the Spalding sign on the what? Spalding sign on the ultrasound. So there is a death of the baby here. Next one is the recurrent. I have told that what is the definition of recurrent. Septic means what? Septic means the what content of uterus infected frequently. Okay, that's very simple. The next one we are going to talk about the anticoagulants in the pregnancy. Anticoagulants in the pregnancy. See, actually, in the normal people, in the normal pregnant women, okay, now. See, if the patient is not pregnant, it means we are as usual normal patient. Then we have actually we have to give the warfarin. But you have to give the warfarin. But if the patient is pregnant in the first semester, okay, now in the first trimester, you have to avoid the warfarin. You have to avoid the warfarin. Instead of warfarin, you have to give the heparin. You have to give the heparin because if you give warfarin in the first trimester, guys, what is happening is that it leads to contraction. It leads to what am I? It leads to contrary syndrome. Okay, leads to contrary syndrome. Okay, na? Meaning there is a hypoplastic development of organs. There is a hypoplastic development of hypoplastic organs due to it is a cartilage defect. It is a cartilage defect. Okay, now again in the 13 to 36 weeks you have to give you can continue the warfarin. Again at the delivery time at the 36 weeks time you have to give the heparin. Okay, after postpartum you have to continue the warfarin. Okay, done. Next one, the amniotic fluids. Amniotic fluids, you have to remember only the examples of, see, where you will see the polyhydramnios, where you will see the oligohydramnios. Poly means what? Many amniotic fluid, more amniotic fluid, and oligo means less amniotic fluid. So obviously, if it is less, then what? It must be due to renal agencies, maybe due to absence of the kidney. So there is a bilateral renal agencies. IUGR, intrauterine growth retardation, preeclampsia, placenta insufficiency, NSAID use. Okay, so this is the most important. This one, they always asking this one, and obviously out of if you remember the one, obviously you're going to remember the another one as it is the MCQs based. Okay, remember all the hernias here. Said diaphragmatic hernia. Okay, atresia here, esophageal and duodenal atresia. Okay, macrosomia, fetal anemia. So these are the examples of the polyhydramnios. Done. The next one is that we are going to differentiate between the PCOS and the OHS. PCOS, polycystic ovarian syndrome here, and the ovarian hyperstimulation syndrome here. Remember here carefully. So a patient is taking the treatment for infertility and is on ovulation inducing drugs. So obviously, remember if the history says that they are taking the history of taking the IVF treatment, history of taking a IVF treatment, then you have to go with the ovarian hyperstimulation syndrome if there is no image in the exam. If there is an image in the exam, guys, you can see here there is a big follicles here on the periphery here. Okay, na? On in the middle side also. Okay, there is a big follicles plus ascites. Okay, na? Big follicles, multiple big follicles, ascites with the history of the history saying that the person is taking the IVF treatment. IVF treatment, then you have to go with the ovarian hyperstimulation syndrome. Well, coming to the PCOS, guys, there is a pearl, there is a at the periphery we'll see the here the periphery, here the both periphery and the middle side there is a there's a how much big size follicles, but here the periphery you can see there is a small follicles here periphery, and the small follicles here. Okay, na? Which is called as the what, necklace string of pearls. Necklace string of pearls appearance. What are the symptoms here we have in the amenorrhea or annulation, which leads to infertility. Hirsutism means the growth of the beard in humans. Okay, so these are the symptoms. So, what is the first statement? What is the first statement? Which is the meaning? Which is the non-pharmacological teacher treatment? Is the first of all you have to do the lifestyle management. Okay, you have to do the lifestyle modification means weight loss. Okay, and then the what is the first drug of choice? It's the letrozole. It is the letrozole is the first choice. Okay, so there is a drug called as clomiphene also used for the treatment of the PCOS. What are the side effects? Is there is a hot flashes. Okay, no? Hot flashes are the side effects of the clomiphene. Next one is the tamoxifen also we will give, but with tamoxifen is having a risk factor, increase the risk factor to endometrial cancer. So these are the MCQs, guys. Please remember metformin given as there is a insulin resistance here. Okay, now for irregular cycle plus hirsutism, we can give the dorsiprenone. For irregular cycle plus hirsutism plus acne, the drug of choice is the cyproterone acetate. Okay, remember these scenarios are going to very important. One MCQ for sure. Remember here the I think you know about this. The what is this? This is the lambda here. This is the T sign here. Okay, now lambda and a T sign. Lambda is seen where dichorionic diamnetic. T sign you see in the monochorionic diamnetic. You will see the here they will ask you as image based questions, and also to identify whether it is a dichorionic or monochorionic. Okay, now what type of twins are there? Okay, now if they ask you which is the most common type of twins, it is the DCDA. This is the DCDA. Okay, now remember if the splitting occurs before 74 hours, then it's going to be the DCDA. If between the 48 days, it is the MCDA. If it is between 8 to 12 days, guys, going to be the MCMA. If it is occurred after 13 days, then it's going to be the form the chance of conjoined twins. Remember, most common type is the thoracophagus. Is the conjoined twins. The most common is the thoracophagus. Remember there is a same sex, blood group, and HLA typing, but the different what? Fingerprints are different here. Remember, twin to twin transfer syndrome seen in where? Seen in MCDA. Okay, so these are more than enough to solve any questions in the here, guys. In the teen pregnancy, remember what is the best time to detect the pregnancy? Teen pregnancy, it is that 11 to 13 weeks here. Complication will be going to the prematurity. Presentation both cephalic, both baby vortex means you have to do the LSCS. First baby vortex, second baby normal, you have to do the breech delivery. Okay, now if it is DCDA, you have to go for the NSVD. Others, At the 32 to 34 weeks of Fmge, you have to do the LSCs. Okay, so these are the questions they are going to ask in the questions exams. The next one, these are the pregnancy. These are the physiological changes during the pregnancy. Remember the further coming to the respiratory. Remember the ICTV and the movies. Okay, na. Remember in the respiratory, these are increased. IC means inspiratory capacity, tidal volume, minute ventilation. They are going to increase here. Constant means IRV. Okay, IRV cancer. I means inspiratory reserve volume, or respiratory rate. V means oil capacity. They are going to constant here. They are not going to change. Okay, except this, they are going to increase or decrease. Okay, they are going to decrease. Next one is the here. See here, what increase or decreases. You have to remember this one. Remember the most commonly they are asking you the here. Remember all clotting factors are increases except what except 11 and 13. Okay, meaning 11 and 13 are going to decreases. Okay, na. They are the important one. And just remember, cardiac output begins where at the 5th week of pregnancy, and the maximum cardiac output will be 28 to 32 weeks. Cardiac output come back to normal after 10 days after the delivery. Okay, na. Continuous murmur, it is a normal. If the diastolic murmur, then mean it is going to the heart. It's going to be heart diseases. Okay, remember S2 sound is normal here, and the S1 sound loud plus splitting prominent. So these are the normal findings in the what during the pregnancy here. Okay. Next one, see here. See here, so these are the one lines. So these are the questions they are going to ask in the exam, but I'm going to make it I'm going to give some hint to solve the questions. Okay, I'm going to give some hint to solve the questions easily. Okay, so if they says that there is a necrosis of the anterior, there necrosis of the anterior pituitary gland, and there is a postpartum hemorrhage. If it says that the patient is failed is unable to feed the baby, are unable to lactate the baby, it means they're asking about Sehan syndrome. What is Sehan syndrome? There is a necrosis of the anterior pituitary gland. So there is a failure to lactate the baby here. So this is the Sehan syndrome. And the next one is the Asherman syndrome. It is the remember in this question what they are going to give. It is a it is associated with what? Hypomenorrhea. Remember, they will say that there is a history of what? There is a history of curettage and dilation. There is a history of curettage and dilation. So, because of this guy, there leads to what? There is leads to what? Adhesions here. There leads to adhesions here. The uterus. So, it leads to Asherman syndrome. Remember, in the question, they will give the patient underwent curettage and dilation. So because of this, it will develop the Asherman syndrome. Okay, now syndrome. The next is what the most common cause of secondary amenorrhea. It is the pregnancy. Most common cause of primary amenorrhea. It is the ovarian dysgenesis. Remember what is Kallmann syndrome. They will mention these key points here. What is the chromosome 46 excess, decreased gonadotropin release hormone, and anosmia. There is a patient will be having the anosmia. So remember these two key points, and we will solve the questions. Okay, the next one is the Turner syndrome. Okay, Turner syndrome here. Turner syndrome, there's a streak ovaries, the 45 streak ovary, webbing of neck shield check, and this will be having the most commonly it will associate with what? With the coarctation of aorta here. Cryptomenorrhea, I think everyone knows about the cryptomenorrhea here. It meaning it is a what? It is hidden menstruation. It means menstruation coming, but it's not coming to outside. The mean the blood or the content of the menstrual blood is not coming, or because of there is a what? It is a because of the imperforate hymen. So there is a amenorrhea and a cyclical abdomen pain, urinary retention, suprapubic pain means the imperforate hymen, which we have to do the cruciate incision. We have to do the cruciate incision on the hymen. Okay. Next, what is the oligospermia, guys? Remember the oligospermia. Remember the oligospermia here. So oligospermia means if the sperm count is the less than 16 million per ml. While the total fertility is 42% is the total fertility. Morphology will be 4%. Remember what is endometriosis here, meaning what you have to see in the exam, guys. They will give the history. They will give there is a dysmenorrhea. Okay, dysmenorrhea. There is a dyspareunia. Dyspareunia meaning, guys, dyspareunia, there is a painful coitus. Fixed plus retroverted. There is a retroverted uterus and a chocolate cyst. Okay, chocolate cyst seen on what? TVS. It will associate with the endometriosis. Okay, na? Remember, the next one is the adenomyosis, meaning there is a menorrhagia plus a dysmenorrhea. Menorrhagia plus a dysmenorrhea. There is a globular uterus plus tender to touch. It is a tender to touch. While coming to the fibroid, it is the non-tender to touch, but there is no pain in the fibroid. Okay, na? That's what you have to identify. Okay, so here, uh, and the treatment will be the total abdominal hysterectomy. Fibroid also you have to do the hysterectomy. Okay. So for the further clarification, guys, please try to follow my regular discussion in the Telegram. So I discuss about this one, about the fibroid and adenomyosis, endometriosis. So what are the MCQs they are asking? But these are the main one. Okay, these are the main things you have to remember. Okay, remember here fibroid. They sometimes they will give the image. They will give this image and they will ask you which is the most common type. This is the intra. Okay, intramural. Okay, now intramural is the most common type of fibroid. Sometimes they will ask us to label the which fibroid is serosal or submucosal fibroid. Okay, na peduncular fibroid. So you have to remember. Next is the types of pelvis here. The most common type is what in girls is the girls gynecoid. A for android, A or for boys is the android. Okay, na boys will love android phone. So android, girls for G gynecoid, girls will love gynae. So gynecoid is the most common. Remember which one is favorable for the phase to pubis delivery. It is the anthropoid. It is the anthropoid for the phase to pubis delivery. Least common is the what? Platypod. Okay. Next one, remember here. Next one, remember who is responsible for handling the investigation in the case of custodial death. Okay. Remember here we are going to discuss about the courts. Oh, types of courts here. Types of courts. Okay, na types of courts here. Going to remember about the types of courts. The first one here. See. So I'm coming from the low to high. Okay, where am I? Low to high. Okay, na? From low to high. So this is the highest one is the Supreme Court. Next is the High Court. Okay, na? So we are going to study from the low to high. The lowest is the what? Judicial magistrate, which is the judicial magistrate. In the judicial magistrate, next one is the second class GM. Next is the first class GM and the chief GM. Okay, na? The lowest is the judicial. Then come to the next is the second class GM, first class GM, then next is the chief GM. Okay, na? Remember we are coming from the low to high. Okay. See here, judicial magistrate we are having the second class GM and second class GM, first class GM and chief GM. How they are going to test us in the exam, guys, is the like how much how many years does a second class GM can do the imprisonment. Okay, announcement. It is the 1 year. Fine will be 5,000. For the first class GM, they will also called as what? Metropolitan. They are also called as Metropolitan Magistrate. Okay, now first class GM also called as what? In metros, it's called as Metropolitan Magistrate. For them, it is the 3 years for the imprisonment and the 10,000 for the fine. Maximum fine 10,000. Remember, chief GM. Chief GM, how many imprisonment? How many years they will give the imprisonment? 7 years. Fine will be unlimited. Okay, unlimited. How they're going to test us, from what level the fine is going to be unlimited, meaning it is the chief gem. Okay, from the chief gem onwards, the fine is going to be unlimited. Okay, the next one is the session judges. It is the session judges. In this session judges, we are having the assistant session judge, and additional district and session judge. See here, for him also, what happened? He will give the imprisonment up to what? 10 years. Up to 10 years only. And from here onwards, all are, they can do the unlimited fines. Okay. Here there is one question: who can give the death? Who can give the death sentences? Okay, who can give the death sentences and lifetime imprisonment? Huda, he is the one. He is the additional. Who is the additional district and session judges? Additional district and the session judges can give the death sentences and life imprisonment, but it must be what? It must be confirmed by High Court. It must be confirmed by High Court. Then Supreme Court. No need to go to the Supreme Court, but High Court can be confirmed. Okay, now. So this is what they are going to test in the examination. Remember, judicial magistrate and the session judges. They are going to they will be under control of state government, and High Court and Supreme Court will be central government. Okay. The next one is the here. Here is the policing case. For the policing case, it is the under 174 CRPC. 174 CRPC. Who can do the policing case? The overall minimum rank is he must be head constable. Next one is the for the magistrate inquest. It will control by what? Under the 176 CRPC. In the magisterial inquest, we having judicial magistrate and executive magistrate. Okay, judicial and executive magistrate. So judicial magistrate, he can do the investigations in the case of, remember the DDR. Remember the DDR, for the D for water, for the death, disappearance, and it meaning death in custody. Okay, na? Death in and also disappearance, like disappearance from the mental hospital, and also child institution, prison death. So these are all under the control of the what? Control of what? What? Judicial magistrate. And what about the executive magistrate? He will be taking charge if there is a what? Death by dowry, and exhumation. What is meaning of exhumation? Exhumation out. Mean they are going to take the body out from the soil. So after doing the funeral, they'll just put in the whatever. Most of the Christians and Muslims, they're going to dig into the body inside the soil, mati. So if there is anything issues, if anything related to the, like if it is a MLC case, then we are going to, if they want, they will do they will tell to take out the body from the soil. So it's the exhumation, out humation. So tell me here, tell the answer. Custodial death, who will take the chance? The what? Judicial magistrate. Okay, now. Executive what? Executive will take what? Dowry death and exhumation. Okay. Then. See here, guys. Please remember, for the ABG, guys, I did a very good session, about half an hour session. I did a separate video. Please watch there. Okay, now please watch there. Okay, now so I will keep the link in the description. Please watch this one. Then you will be will get more confident. Okay. The next one, extraction of the what? Urine. Means it meaning urine is going to accumulate where? If there is just remember, Remember this is the statil, this is just the statil injury, and there is a statil injury is due to what? While riding bicycle on a bumpy road, man falls into the man falls into manhole. The most commonly is going to be the pelvic fracture. Okay, now which is the most common this is the patient will fail in the patient will, example, a man is fell in the manhole. Okay, na, in the manhole, meaning the most common is going to be the bulbar urethra. Bulbar urethra is going to damage. Okay, na, if the history see here, if you, just simple lesion, uh, while solving these type of questions, guys, please try to read the history. If the patient is fell in the in the manhole or from the motorcycle, if it is manhole, think about bulbar urethral. if it is if it is motorcycle, think about the membranous urethral injury, meaning there is a pelvic fracture. Read the questions carefully. So remember, if it is the membranous urethra, meaning it means there is a pelvic fracture. So the urine is going to extravasation in the deep perineal pouch and space of 80 gs around the bladder and portion. Remember, if the patient is fell in the manhole, what happens? The most common is the bulbar urethra, meaning the injury due to what? Staddle injury, meaning here by bicycle. So the urine is going to extravasation at the what? At the superficial perineal pouch, scrotum, penile shaft, and anterior abdominal wall. Done? Done. Okay. Remember, which is the traveler's diarrhea is caused by ETEC. ETEC, what is that? That is the enterotoxigenic E. coli. Okay, now see EPEC what? Enteropathogenic. It causes the pediatric or infantile diarrhea. Okay, na, E. coli. These are the types of E. coli. Okay, so EP. So next one, ET. E. coli means ET means what? This is the traveler's diarrhea. EIE means invasive, enteroinvasive E. coli causes the bloody diarrhea. EHEC means what? Hemolytic E. coli. It causes the hemolytic uremic syndrome. Remember this is the stain is the O157 to H7. Is the stain for the EHEC. Once upon a time they asked this question also. EAEC means what? Enteroaggravative E. coli. It causes the persistent. It causes the persistent diarrhea. It causes the persistent diarrhea. Done. So these are some important microbiology related questions. So we need to remember. So this is the Vibrio cholera. This first one is the Vibrio cholera. They will ask about the what is the culture media is the TCBS. So remember, remember all the see here all the culture medias. I already made a separate video about the culture medias. Okay, now all the culture videos. Okay, now I made a separate video. Please try to get it. Actually, the link I will provide the link in the description. Okay, now so remember. So I will. So they are okay. This is already discussed in that video. Remember, okay, this is next one is the scar formation seen in two cases where in the if they will ask you if they are giving the anthrax. Okay, now they will give the cattle as the history, but if they are giving the scrub typhus, it means they are going to give the history as the what? There is a mite bite. There is a mite bite. Okay, remember in the exam questions, guys, if they are going to give the what? There is a black color scar formation and the patient is a cattle. Okay, the patient is a cattle. Patient is having a cattle. Okay, they then meaning he is a what? He is going to dive with the anthrax, but he's not a that one. But he has a history of what? Might bite. Then they will give correctly. Okay, na, there is a scar formation, but there is a history of what? Bite might means it is going to ask about the scrub typhus. Okay, next one, Corynebacterium diphtheria. Everyone knows this is the membrane, gray white, sore throat, bulla snake will see. There's a Chinese letter formation. Okay, it's like a Chinese letter. Remember, there is a low flush methylene blue stain for the early diagnosis. Low flare blue methylene stain for the early diagnosis. But this is not but this will not give the exact prognosis. But potassium tellurate agar is the best media, but it will take some time to further diagnosis. Okay. Next, coming to the measles, rubella. See here, measles it is also called what? Rubiola here. How to remember? See rubiola. See rubiomla means rubiom means what? O for rubiola. O for what? Rubiomla means M means what? Measles. Just for the basics for the mnemonic like rubiomla means rubiola. To differentiate rubella means everyone knows that the rubio. Everyone is going to confuse about rubella and rubiola. That's why I made a mnemonic for that one. It's the rubiomla. Okay, M means measles. So there's a conjunctivitis. 3C of the rubella. Rubiola is a conjunctivitis, cold, coryza, and okay na. Coryza. Remember there is a what vaccine there is a for the measles there is a what Edmonston vaccine. There is a what symptom is the coplic spot possible opposite to the what second lower molar. Complication is the SSP subsclerosing panencephalitis. Mumps there is a bilateral parotitis and there is a unilateral orchitis. Okay na. Vaccine is the Geril stain vaccine. Rubella, there is a associated with what? Congenital rubella syndrome associated with the PDA, SNHL, cataract. Okay, na? Remember the प्यार में अंधा बहरा प्यार में अंधा बहरा प्यार love means heart PDA andha eye meaning cataract behra okay na behra here it means to what SNHL that is the rubella congenital rubella syndrome okay na vaccine is the RA 20/7 vaccine. Next, HPV. Remember here, HPV, you have to remember, L1 is the what? Type 1 vaccines here we having the L1 is the capsid protein and E6, E7 will be the most carcinogenesis and E4, E5 will be what? From the coilocytes. LJ media for the TB. I think everyone knows about this one. LJ media for the TB. So remember here all the, okay now. See, all the questions, all the culture measures are briefly discussed in the video. Please watch it. The next one is the pyogenic liver and amoebic livers and the hydatid disease. So I think everyone knows about this one. So no need to explain the hydatid cyst. What is the water lily sign here? CCTU or the classification is the Gharebi classification. Treatment what percutaneous aspiration infection of the scoliosis agents and respiration plus albendazole is the drug of choice here. So no need. I think no need to explain this one. So pyogenic and amoebic liver they are asking more about the amoebic liver disease. So they're going to be the image-based questions from here. Okay, now so how to remember the images here. Okay, so I think no need to remember to tell. So from the pyogenic, what is the pyoma? Pyo means what? Pus. Okay, pus meaning there is a pus formation in the liver here. At the most common cause of the pyogenic liver abscess in the worldwide is the E. coli. In the Asia is the Klebsiella. Meaning India also there is a the Klebsiella is the most common cause. There is a ascending cholangitis spreading. There is a fever and chills. In choice the blood and the pus culture. So you have to take out the you have to aspirate the pus and you have to do the culture. Okay, na? In LFT, it is increase the ALP levels. Treatment is the broad spectrum antibiotics. So include the meropenem also here and ceftriaxone meropenem and the aspirin. Peptides also you can give and the aspiration drainage with the pigtail catheter. Okay. Histolytic anemia is the amoebic liver abscess. Histolytic anemia there is the intestinal amoebiasis, enterohepatic circulation spread. This is the ascending coronary spread. This is the enterohepatic circulation spread. The most common site is the right liver. Okay, is the right lobe of the liver is the most common site here. Investigation of choice is the you have to do the serology. The PTNI will be increased. Treatment will be the metronidazole. There is a Encovis aspus. The if you do the what is the aspiration, it will look like this one. There is a Encovis sauce like pus. Okay, just to see this is the water lily here. You see the water lily sand here. Here the patches are very larger here. Okay, so this is how you have to go into abscess. So pyogenic and pyogenic, amoebic, and hydatitis. These are the very important one. Remember also here. So okay, I think everyone knows about. You will also study this one in microbiology also. Okay. So now for this one, guys, please remember about the t-test and everything. This is a bar diagram, everything. I already discussed this about in a separate video. Okay, na? Please try to watch Please try to watch the video. Okay, so I will provide the link in the description. Okay, na? I will provide the link in the description. Please, okay, na? This also link in the description. 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 Okay, so please try to watch this. I provided the link in the description. Please try to check the description. So okay now, so please check the description. I already discussed this all very briefly. Okay, the next one coming to here, we are going to talk about the two important diseases are the Parkinson and the Alzheimer's disease. Remember that in the Parkinson, what happens? There is a low dopamine. There is a low dopamine. Dopamine will see, remember, see, Parkinson, there is an abnormal protein. There is an abnormal protein which is called as alpha synuclein. Alpha synuclein. This protein is going to form the abnormality. Due to abnormality, it is going to accumulate in the substantia nigra. Where at the substantia nigra, which and a group of alpha synuclei in the substantia nigra is called as what, amma? It's called as Lewy bodies. Called as Lewy bodies. So if it is accumulated at the substantia nigra, then what happens? Substantia nigra is responsible for the production of the dopamine. So it is also responsible for the production of the neuromelanin. What if it is there is a what if there is a uh, there is abnormal protein accumulation of the like alpha synuclein, then there is also a degeneration. There is a hyperpigmentation of the what substance nigra here. So that's why change here. There is a this is normal one. There is a hyper what pigmentation of the what substantia nigra here. Then why there is a decrease of the production of the melanin, guys. That's why melanin and also the increase the production of melanin and also what is the dopamine here. So remember, the dopamine is the most common cause. So there is a less production of the dopamine in the substantia nigra, where at the pars compacta, because that depigmentation. So sorry here. It's not a hyperpigmentation, guys. Remember, due to the destruction of the melanin. So here it causes the what? Depigmentation. Okay, now there's a depigmentation. Remember, okay, now. Okay, it's a what is hyper or hypo? Tell me. It's a depigmentation. Okay, na? Don't confuse. Done. Good girl, good boy. Okay. Symptoms will what at the age of 60? There is a pin leg rolling. Okay. Pin rolling tremors. There is a cogwheel rigidity. Okay. There is a cogwheel rigidity. Bradykinesia. Shuffling gait. Small writing. Very small handwriting. There is a postural instability. Always his tendency to always fall. We don't know whether he is going to fall at any time. Okay, now treatment will be always what is L dopa, L carbidopa plus dopa plus carbidopa is the you have to give in the combination one. Okay, now drug induced pollination you have to that drug of choice is the benzohexol. Okay, Levy bodies here. Next one coming to the Alzheimer's disease. This Alzheimer's disease they are the very the worst fellows. They don't know that they don't know that okay my body is getting very smell my body is very muddy. They don't think they don't have that the type of like smell also like their body is very what there's more smell very muddy. They don't even bath also. They think that okay I am very healthiest people, but they are the very dirtiest people. They don't bath. They don't change their clothes daily. They don't comb their hair. They don't brush also. They're very ugliest person. They will forget everything. Really. They will forget everything. They'll forget everything. Just check here 5A's 5A of Alzheimer's here. Remember remember the symptoms are actually I didn't kept there. Okay. See here. See, 5 of Alzheimer's are here. Anomia, inability to remember names of the things. Apraxia, okay, misgaze of objects because of failure to identify them. They can't identify that okay this is the remote, this is the phone or not. Nothing. Agnosia, inability to recognize familiar object or taste of the smell. Okay. Amnesia, loss of memories. Aphasia, inability to express through speech. So, okay, these are things you have to remember the 5 A's of the what? Alzheimer's here. Okay, next one. What happens here is that see here there is a abnormal protein. What abnormal protein is which is called a tau protein or I'll see here in the case of a tau protein is going to accumulate. You know, tau protein is going to accumulate and if it is going to accumulate if it is going to accumulate in the intracellularly, it is where intracellularly if it is going to accumulate in the intracellularly, then what it is, what it forms the what it forms the neurofibrillary tangles. It forms the neurofibrillary tangles. Remember the number of degrees. Remember degree of dementia is correlates with the number of tangles. Meaning if there is more number of tangles, then the degree of dementia will be more. Okay. So actually I didn't explain you the basics here. Alzheimer's is there Alzheimer's, what happens here, the most common cause of dementia in adults. I think everyone knows now about the Alzheimer's now. That's why I didn't explain the basics here. Remember, what the most common chromosome is the chromosome 19 and apolipoprotein what apo E gene. These are the apo gene, apo E4. These are the most common causes. More common chromosome and apo E4 gene they are involved in the Alzheimer's diseases. Patients who are diagnosed with the Down syndrome having the risk of developing early onset Alzheimer's disease as what? APPP, where APPP due to accumulation of the APP amyloid precursor protein on the chromosome 21. This will be in whom in the Down syndrome patient, they're having the high risk of developing early onset of the Alzheimer's disease because of the APP present in Verama at the 21 chromosome. Remember, there is a many chromosomes, but the most common is remember 19 and ApoE4. And remember, for the Down syndrome patient, the apoprotein APP is where at the 21. So APP response for the Down syndrome patient. So APO E2 is the risk from the it is the risk for the sporadic form. APO4 is the increase the risk. So sorry, APO2. Okay, APO2 is the decrease the risk form, but APO4 is the increase the risk. Okay, na? So that's what. So remember here. Okay, done. So okay, so where the and also remember for the extracellular, what is the first? Remember the intracellularly where at the intracellularly tau protein forms at what intracellularly tau protein accumulation is called as neurofiber tangles. Whatever extracellular accumulation of, remember extracellular accumulation of what? Amyloid A beta. What is amyloid A beta is called as what? Neurotic plaque. It's called as neurotic plaque. Okay, now this is the what? See, neurotic plaques, which is inside. They will show you guys neurotic plaque. They will ask you what is the inside it. It meaning it is a amyloid A beta. Okay, neurofibril tangles. What is that? Tau protein at intracellularly, but extracellular accumulation of what? Amyloid A beta, which is called neurotic what? Plaques here. Okay. And the group of both, see, remember, see, bodies are a group of what? That is the tau protein, neurofibril tangles, and the bodies. We'll see that. So remember, what is that? Treatment we will see the donepezil, most commonly rivastigmine as the patch from galantamine membrane, and the memantine is the NMDA antagonist. Okay, so it's just a okay. Yeah, so it's just a rapid region. So rapid region. So that's why I didn't explain it very well. But you have to remember these important topics from the Parkinson and Alzheimer's. So these are the very important one. Okay. Okay, so next one here we are going towards the this one. So this one they will give the question from this side. How they're going to test us in the, it's not a test, it's a test. Okay, so in the exam is this is the nephron. They will just give the image of the nephron, but okay, they're going to mark us in the types of, this is the part of the nephron. So this is the they will remember this is the first part, this is second and third and fourth part here. So they'll just mark us. So okay, so this is the first part. So which of the following drug will act here? Which of the following drug will act here? So that's how they are going to ask the questions. Okay. So this is the first part here. The first one is the mannitol. Yeah, okay, na? So in the PST guys, in the PCT, proximal commutator tubule, the PCT, the mannitol is going to act at the PCT. Okay, now so as they will ask the questions, which is acting as the first one. Okay, as a PCT, okay, is going to be the mannitol. Oh, okay, the answer will be mannitol. Just that's how you are going to remember. If I say that, just remember the landmarks. That's it. That's more important for us. Okay, next one. Estrogelamide also at the same time at the proximal commutator tubule. But remember, sometimes they will ask you guys estrogelamide, what the mechanism of action. Okay, that's it. Next, coming to the what third one is the loop diabetes. Okay, now this is the loop diabetes. Loop diabetes, you have to remember it inhibits the co-transport. What is the co-transport is the what? Is the sodium, potassium, and 2-chlorine is the they inhibit what sodium, potassium, and 2-chlorine. This is the most important. Remember the loop diabetes. This is the most important. They are going to ask they also ask which of the following will act at the number 3. It means number 4, whatever number, but you have to remember, okay, there's a loop diabetes. Okay, there's a loop diabetes is going to inhibit the sodium chloride and sodium potassium and 2-chloride. Okay, done. That's what you have to remember. That's it. Okay, now the next one is the thiazides. At the distal commutative example, hydrochlorothiazides. Okay, na metallazone. So remember, one thing I want to explain here. This is the what? Metolazone. See here, metolazone is the very good drug of choice for the people who are with the CKD, who are with the CKD, who are with the CKD. Okay, na hypertensive people with the hypertensive patient with the CKD, the best drug of choice is the metallozone. Remember here. Okay, na thiazides, they will inhibit the sodium chlorine, inhibit the sodium chlorine, what? Sodium chlorine reabsorption in the early part of the DCT. Okay, done. Done. So side effects, just no. Next one is the last one is the potassium sparing diabetes. Potassium sparing diabetes example spironolactone, eplerenone, and amyloride. Okay, just remember the small things. Okay, but the main focus is that at what parts, okay, diuretics, loop diuretics are active. That's it. Next one is the H pylori therapy, triple therapy, quadruple therapy, and a sequential therapy. So just remember, okay, na? I don't have any money to remember this one. Just it's you, okay? Na? But remember, okay, we are going to use the any two, any two here. See, mostly we are going to use the amoxicillin here, amoxicillin, clarithromycin, any two, clarithromycin, amoxicillin, metronidazole plus okay, so Any2 means out of these three, clarithromycin, amoxicillin, metronidazole, we are going to add the PPI. So any two means either we can use the amoxi plus metro plus PPI. Either we can use the clarithromycin amoxi plus esmazole adenine, meaning only two antibiotics and one PPI. Here quadruple means four. Tetracycline is going to add it here, metronidazole and the bismuth compound for the for the covering agent you are going to use. Okay, na? Like this you have to use. The next one is you are going to use the for the anti-vomiting drugs here the domperidone and the metoclopramide. I think everyone knows. Okay, just read about this little bit. Remember that this is doxylamine, highly sedative. Okay, na? A drug of choice in morning sickness. Vitamin B6 must be added for the to reduce the side effects. Okay. Next, diphenhydramine used for the treatment for the motion sickness as a transdermal patch. Okay? As the transdermal patches and vertigo. This is the okay. This is the fexinone. This is the fexofenadine hydrochloride. Actually, I actually for the patient with cough, if you are going to give the ascoril and the LRD, they're going to cause the increase in the sleepiness in the daytime. But while coming to the fexofenadine, guys, it won't cause that sedative. So it is the going to be very best for the people for the small childrens with the for the small childrens, guys. Okay. So this is the question they ask in the exam once upon a time. So the next one is the jaundice, physiological jaundice and pathological jaundice. So physiological jaundice means jaundice which arriving after which jaundice means say here means it is called as what a hyperbilirubinemia. It's called as what hyperbilirubinemia means meaning more biles. So physiological jaundice appear after 24 hours after 24 hours of the birth. Okay. Actually, the physiological jaundice will it's a very normal is a normal physiological physiological jaundice is a very normal in all the babies. Okay, but pathological but everyone knows about the physiological jaundice, but pathological jaundice is very important one. Okay, now so it will appears within the 24 hours of the life. So when you say that it is what are causes of the hemorrhagic or either non-hemorrhagic. So you have to check whether if it is hemorrhagic gas, it's going to be the RH incompatibility, ABO incompatibility, and G6PD deficiency. Non-hemorrhagic so infections, hypothyroidism, biliary atresia, and the breast milk jaundice. Okay, so these are the important things you have to remember from the pathological jaundice. So I will be discussing about the just know about the what are the causes of the pre, intra, and post hepatic. So please remember, just write down. Just once go through the pre hepatic, post hepatic, and intra hepatic causes of the jaundice. Okay, and there are many like I'm going to I will discuss about the direct and indirect direct and indirect jaundice, okay, pathological jaundice. There are some many diseases like Gilbert syndrome, okay, everything is there. So I will be discussing further in the further videos. But you have to make sure that just write here, okay, just write here. There are some spaces. Write the pre-hepatic, intrahepatic, and post-hepatic causes, and the okay. The treatment is the phototherapy. See here, if I want to say in one line, if I want to say in one line, see, actually here, see here, no need to remember, no need to remember anything from this slide. If I want to say in one thing, in one word, see here, just remember the images are important. Remember what are the cyanotic and acyanotic diseases. What is acyanotic? Meaning, acyanotic means there is a what left to right shunt, left to right shunt. Okay, now so left side having the oxygenated blood, right side will be having deoxygenated blood. If deoxygenated, if oxygenated blood will mix in the deoxygenated, nothing will happen. There is no cyanosis now. So it is a acyanotic example: ASD, VSD, PEA, coagulation of aorta, pulmonary all stenosis. Cyanotic means what? Right to left. See, sent. That's why it is what? This is a cyanotic means we have in the TOE of pulmonary stenosis, TGA, and TAPP. Okay. Just remember what are the cyanotic and acyanotic, and also remember, guys. So remember the images are very important. The images are very important. So this is the what snowman figure of 8 appearance here. Okay, this is the snowman pattern. This means tap via total anomalous pulmonary venous return. Remember the image here, a figure of 8. This is the what? This is the egg. TGA transposition of aorta. In TGA, aorta rises from the right ventricle and pulmonary artery from the left ventricle. Remember, just read this matter, but no need to remember. Just read but you guys, you have to know the images are very important. That's it. Okay, no need to go to in detail. Okay, next one is the Epstein anomaly. This is the what box shaped. This is the box shaped heart. Box shaped heart, and the X-ray is in the Epstein anomaly. It is associated with what? It is associated with the lithium injured with the lithium induced during the pregnancy. And the ECG we will see the Himalayan PVS, meaning there is a very tall PVS, very tall PVS. Okay, na? We will see the very tall PVS. Okay, like a Himalayan Parvat. That's why it's called a Himalayan PVS. Okay, now coming the top tetralogy of Fallot. I think everyone knows about the tetralogy of Fallot. Pulmonary, infantile stenosis, right ventricular hypertrophy, overriding aorta, a large BST. So these are the four. What tetra means? So these are the four components of the what TOF. Okay, na? That's it. VSD, ASD. So remember, so please try to differentiate. Try to read this one. Okay, na? ASD is associated with the Holt Oram syndrome. I think everyone knows because in the ASD, what happens, like in most of the children, the ribs are not going to form. The ribs are not going to form correctly. So and also the ribs are going to attach. Like, attach. They're going to attach in one rib. Okay, now one fuse. The first and second rib is going to fuse because that one, guys. Also there is it is also a risk for the ASD. Okay, 1 minute, guys. So I will just wait. Just close the door. Okay, done. Dun, dun, dun. What happened to the morning? I'm clear. Okay, so ASD. Remember here. So in the in the X-ray, we'll see the jug handle. What is the jug handle type of what? Jug handle type of what? Heart we'll see in the ASD. Okay, na? So just remember This one the next the VSD. So in the VSD, what happened? Most common congenital heart in children is the VSD. It's the most asymptomatic heart disease in children and most commonly affected by what infective endocarditis. Membranous part is most commonly involved here. The incidence of spontaneous closure is high in VST, so particularly in the muscular part here. The auscultatory hallmark of VST is the what? PAN systolic. The PAN systolic murmur. What is the murmur? Is the PAN systolic, also called as Roger's murmur. Roger's murmur. Okay. So this is the important one VSD. So what is Eisenmenger syndrome? Okay. What is Eisenmenger syndrome? Suppose example, if there is shunt between the left and right, but immediately if there is going to be right to left shift, that's called the Eisenmenger syndrome. Okay, now. So these are the things. I'm going to go in like a broad one. So just remember the image and the murmurs. Murmurs are very important. In the PD era, you can PDA. I told that in PD era, there is a what? There is a machinery like. There is a machinery like murmur. There is a machinery fast machinery like murmur seen in the PDA. Just these that's murmurs and the condition is very important. That's it. No need to read everything about this one. Okay. I told that quadrational aorta is seen associated with what? Turner syndrome. There is a figure of 3 appearance. There is a figure of a 3 appearance in one. Okay, na? In the quadrational aorta, what happens? It is congenital asymptotic heart disease in which there is a constriction on the corner part of the aorta just below the what? Below the left subclavian artery, resulting in the disparity of the volume pulse with the high pulse in the upper limbs and lower and the limbs. Meaning what happens at the water at the iota, there is a what? There is a stiction. There is a constriction of the what? Constriction of the iota. There is a, if there is constriction, then it will look like a figure of 3. See here, there is a constriction of the iota here. Corners for the iota. Okay, if there is constriction means what happened? The blood will not move to the what? Move to the lower limbs. So that's why there is a pulses difference. There is a pulses differences in the what? In the upper in. So there is a pulses difference. There is a pulses differences in the both upper and lower limbs. So there is a what? Figure of 3 appearance. So this is the last one. I'm going to switch off after this one. Oh my god. Wait. Okay. No charging. Okay, done. Then next one is the okay, can we start tomorrow? This is the surgical part. Okay. The more from here there is more surgical part. I'll start it tomorrow, okay? In the next session. Okay. Thank you very much, guys. Love you and take care. So no need to remember, no need to bother about these more. But I just said that read only the marked one. Okay, na? Read first of all, clear all the images. Shoe shape like the TOF. Okay, car shape, a snowman type, a TGA eggs on string, and the whole history murmur. You'll see machinery murmur, whole trauma syndrome associated. Okay, na? Remember this one, or else nothing. They're going to ask nothing in the exam. Okay, no? Just chill, guys. Okay. If you want it, then you can read. But the main focus is on the images. Okay. Thank you.